hello, today we are going to analyze the tongue of a person whose clinical history unfortunately is not known to us. All we have is just the image of the tongue, and let's see what tale it would tell us. Well, the very first thing that strikes the eye is the thick coating, especially here in the area of the lower burner. If you look closer, you can also see that the coating fills in the crack, and there is this area here which has fur inside of the coating, right? And we know for sure that this is an indication of phlegm. Well, in conjunction with the teeth marks here on the sides, we certainly already see the picture that person's center is not transporting and transforming, and the turbidity is sinking into the area of the lower burner. Now, I would be asking such a client questions about their bowel movements. Are they relieving themselves regularly and completely? Most probably not, judging from this picture. Next thing that strikes the eye is the tip of the tongue. Look, it is red here, and there is also a midline crack that reaches all the way to the tip of the tongue. And this is the area of the heart. So there is an element of heart fire, and plus possibly with an element of yin deficiency. So another question that I would be asking this person, how are they sleeping? What is their mental status? And another striking element of this tongue is the midline crack, midline crease that separates the whole tongue into the left and the right sides, like two hemispheres. And we know that an extended crack that extends through all the three burners is always a sign of kidney deficiency. And so we have heart and kidney not communicating. Philosophically speaking, it's a very interesting situation. That's where your will and your heart are not aligned. So a person kind of lives a double life without passing any judgment. Another interesting feature that is hard to see here on the tongue, but you can see here that the root of the tongue is actually depressed. So that's another evidence of kidney essence insufficiency. Okay, so if we are to put it all together, we have the following. We have the middle burner. I'm going to write as a Chinese character for middle, zhong, not transforming and not transporting. And it results in phlegm-dampness. Okay, which settles down into the lower burner. That's one story. Another story is the heart fire. I'm going to say heat to be more conservative. Fire. And the third level of this story is the extraordinary vessel. The constitutional level is involved here because the kidneys are certainly involved. There is an element of yin deficiency, and heart and kidneys are not communicating. Next, if you look at the sublingual veins, you can see that they are actually distended, and mostly they involve the middle burner. So there's most of the stagnation here in the middle. So this is the middle burner stagnation. Do they have stomach pain? If not, how painful are their periods? I assume this is a woman. So these are the questions we would ask. So dampness also leads to blood stagnation. Okay, so the treatment strategy. First, we're going to clear heat from the upper burner. We're going to use fire points, heart 8 and lung 10. Next, we are going to help to push down all the water and help transformation. And surprising for many point would be lung 5. Why? Because the lungs serve as the organ that sends the water down, and we want to create this downward movement so that upper burner is helping the middle burner to transport and transform the contents of the digestive tract. Okay. Next, of course, we have to address the middle burner directly. So we are going to add stomach 36, the He point, plus spleen 9. Anytime there is turbidity, we are going to use this combination of points, plus specifically for phlegm stagnation, we are going to use stomach 40. These 3 points will take care of harmonizing the middle burner and changing the pivot to create downward movement and clear stagnation. And by clearing phlegm stagnation, we are hoping the blood stagnation will dissipate over time as well. Now, just like I said, I don't know the exactly clinical history here, and if the blood stagnation was a more dominant factor, I would be adding maybe spleen 10 to the formula. But for now, we're just gonna focus on the phlegm dampness. Next issue to address would be the extraordinary vessels, the vertical crease. So I would start with the combination of spleen 4 on the right and pericardium 6 on the left to open the Chong Mai, the extraordinary vessel, the sea of blood, which would harmonize the upper, the middle, and the lower burners. And I would also use the lung 7 on the right, plus kidney 6 on the left, to open the Shen Mai, the sea of Yin. And this would create a good communication between the heart and the kidneys. Naturally, to connect these two channels together, we may add Ren 12 is a good point for the middle burner, and Ren 4 for the lower burner. If again, if we want to address the upper burner issues more, then we're going to add Ren 17. And going back to the idea of transporting and transforming phlegm, we want to have kidneys, the constitutional level, supporting our digestion, and therefore we would be adding kidney 7, a great point to regulate water metabolism. So that would be my formula for this case.